Are you taking medication for blood pressure, cholesterol, allergies, depression, or acid reflux? Stop for a second, because most women over 60 who take these medications every single day have no idea that they could be the reason behind their low energy, dry skin, poor sleep, and loss of intimacy. Not their age, their medication. And here's the part that will surprise you. Nobody stopped taking anything. Nobody needed to. They just asked their doctor one specific question, and things started to change. Today, we're going over the 5 most common medications that silently affect your sexual health, your skin, and your energy after 60, and the exact questions to bring to your doctor at your next appointment. Because here's the truth. Doctors rarely bring this up on their own. If you don't ask, this conversation simply doesn't happen. But after this video, you'll know exactly what to say. I want to tell you about a woman I'll call Patricia. Patricia is 67. She takes 4 medications. 1 for blood pressure, 1 for cholesterol, 1 for mild depression, and 1 for allergies. She's been on them for years. She manages her health. But somewhere along the way, things quietly changed on her. Her energy got lower, her skin drier, her sleep lighter, and her interest in intimacy, which had already shifted a little after menopause, almost completely disappeared. She mentioned it to her doctor once. He said it was normal for her age and moved on. She didn't push back because she didn't know how. So she went home and quietly accepted a version of herself she thought was inevitable. What she didn't know was that 3 of her 4 medications were on the documented list of drugs most likely to cause exactly those symptoms. Not her age, her medication. And nobody had connected those dots for her. If any of this sounds familiar, hit subscribe right now, because this is exactly the kind of honest, practical information this channel is here for. Let's get into it. Here's why this happens, in simple terms. Most medications work by blocking or slowing down a specific process in your body. That's how they control blood pressure, reduce cholesterol, or quiet an allergic reaction. But your body isn't a set of separate switches. When a medication changes one thing, it often changes several things at once, including circulation, hormone production, nerve sensitivity, and moisture levels throughout your body. The medication isn't doing anything wrong. It's just doing what it was designed to do, and the effects spread wider than just the target area. The problem is that most prescribing conversations focus on one problem without mapping out everything else that shifts as a result. Here's the number that genuinely surprises most women. Studies consistently estimate that between 25 and 40% of women on certain medication categories experience some kind of impact on sexual function. And that's only the women who actually report it. The real number is almost certainly higher because most women assume it's age, not the medication, and never say anything at all. They buy another cream. They try another supplement. They quietly stop initiating. They tell themselves this is just where they are now. And the medication that could have been adjusted or switched sits in the same bottle, unchanged for another year. Now let's go through each medication, one by one. Medication 1. Blood pressure medication, especially beta blockers and diuretics. These are some of the most prescribed drugs for women over 60, and for many women they're genuinely important. But here's what most people don't know. Beta blockers work by slowing your heart rate and reducing the force of your circulation. And that reduced circulation doesn't only happen in your heart, it happens everywhere in your body, including the genital tissue that depends on strong blood flow to feel aroused, sensitive, and naturally lubricated. Think of it like turning down the pressure in a water system. Less pressure everywhere, not just at the tap you were trying to fix. Many women on beta blockers also report a kind of emotional flatness and persistent fatigue that quietly kills sexual interest before anything else even happens. Diuretics make things worse by pulling fluid from your whole body, which directly dries out tissue from the inside out. What to ask your doctor? Is this class of medication known to affect circulation and sexual function? Is there an alternative class I could try with a lower impact in that area? Some categories of blood pressure medication, like certain ACE inhibitors or ARBs, have a significantly better profile on this. Simply switching within the same therapeutic category is sometimes all it takes, and it's a conversation most doctors are very willing to have if you bring it up directly. Medication 2. Statins for cholesterol. This one genuinely surprises people. Most people think statins only affect the liver and cholesterol numbers, but cholesterol is actually the raw material your body uses to build sex hormones. Estrogen, progesterone, and testosterone are all made from cholesterol. It's a bit like reducing the supply of a building material and then wondering why the finished buildings look different. When statin medication reduces cholesterol production in the liver, hormone production can get caught in that reduction too, not always dramatically, but sometimes enough to notice. Some women on statins also deal with muscle aches and general fatigue, which quietly lower energy and interest in intimacy before anything else becomes obvious. What to ask your doctor? Have my levels improved enough now that a lower dose could still keep me in a healthy range? Have we looked at dietary approaches that could support the medication and give us a little more flexibility? Not stopping it, just optimizing it so your body has a little more to work with. Medication 3. SSRIs and antidepressants. This is the most documented category on this list and still the one nobody talks about. SSR is increased serotonin in the brain, which helps stabilize mood and is genuinely useful for many women. But serotonin and dopamine are closely linked in the brain's reward system, and dopamine is the neurotransmitter most responsible for desire, motivation, and the actual experience of physical pleasure. When you raise serotonin through medication, dopamine can get dampened as a side effect. Many SSRIs also specifically affect the nerve pathways involved in reaching orgasm, sometimes making it much harder, sometimes making it nearly impossible, even when everything else feels fine. Studies consistently show that between 30 and 40% of people on SSRIs experience some form of sexual side effect. That's a very significant number. And it almost never comes up at the prescription appointment. Women walk out with a prescription and months later quietly assume their body has simply changed. What to ask your doctor? Is the specific medication I'm on one of the ones with a higher or lower known impact on sexual function and orgasm? Are there alternatives, either in the same class or a different one, that might be equally effective for my mood with less of that effect? Some antidepressants work through a completely different mechanism and don't carry the same sexual side effect profile, but you have to ask. It won't come up on its own. Medication 4. Antihistamines. This is the one most women dismiss because it feels too minor to matter. 1 little tablet for allergies. How much could it do? Quite a lot, actually. Here's how it works. Antihistamines block histamine receptors throughout your entire body to reduce allergic response. The problem is that histamine receptors exist in all your mucous membranes, your nasal passages, your eyes, your throat, your mouth, and your vaginal tissue. When antihistamines reduce secretion to manage your allergies, they reduce secretion everywhere, all at once. Dry eyes, dry mouth, dry skin, and vaginal dryness all showing up together can sometimes be one single daily tablet doing its job too broadly. Women who have been spending money on eye drops and lubricants for years while taking a daily antihistamine sometimes find that addressing the antihistamine first is the piece that actually makes a difference. What to ask your doctor? Is there a more targeted option I could use most of the time, like a nasal spray, and keep the full systemic tablet only for my worst days? Some newer antihistamines also have a meaningfully lower drying effect on the whole body. It's worth asking which one you're on specifically. Medication 5. Proton pump inhibitors and long-term antacids. Millions of women over 60 take these daily for acid reflux or stomach protection, often for years without reviewing whether daily use is still necessary. The issue is straightforward, but almost never explained. Your stomach acid isn't just there to break down food. It's also the key that unlocks certain nutrients from the food you eat, specifically vitamin B12, magnesium, and iron. When a PPI reduces your stomach acid significantly, long-term, it also reduces how much of these nutrients your body actually absorbs from every meal. You could be eating well and still be quietly running low on all three. Vitamin B12 affects your nerve sensitivity, your energy, and the neurotransmitters involved in experiencing pleasure. Magnesium affects your sleep quality and muscle relaxation. Iron affects how well your blood carries oxygen to every part of your body, including your genital tissue. A woman whose B12 is low may feel less sensation, have poorer sleep, and feel generally flat in her energy and assume it's just age. It might partly be a nutrient absorption problem sitting underneath her stomach medication. What to ask your doctor? Have you checked my B12, magnesium, and iron levels recently? And, at this point, is daily use still the right approach for me? Or could I use it on demand and see how I do? These are simple and completely reasonable questions to raise. Before we go further, I want to say this clearly. Nothing in this video is advice to stop or change your medication without talking to your doctor first. These medications exist because many women genuinely need them. Stopping them without medical guidance can cause real harm. What this video is giving you is language. Awareness, the ability to walk into an appointment and ask a specific question instead of leaving with a vague reassurance. Here's something important to understand. Doctors don't usually bring up sexual side effects on their own, not because they don't care, but because they assume you'll mention it if it's bothering you. And most patients assume the doctor would have mentioned it if it mattered. Both sides wait. Nobody talks. Years pass. Symptoms pile up. Women quietly adjust their expectations downward, one thing at a time, assuming this is just what getting older feels like. It becomes invisible because nobody ever names it out loud. The result is that millions of women are living with symptoms that have a clear, addressable cause, and nobody is connecting the dots for them. That ends the moment you walk in with a specific question. Not a complaint, just a question. Let's go back to Patricia. Once she knew to ask specifically about her blood pressure medication, her doctor did have a different option available, in a different class, with a lower documented effect on circulation. She didn't stop her medication. She simply switched within the same category. She also found out her B12 had been quietly low for a while, from her long-term antacid use, and nobody had checked it in years. Her doctor added a supplement. Within 3 months, her energy improved noticeably. Her sleep got better, and her interest in intimacy, which she had genuinely believed was simply gone for good, started coming back quietly and then more clearly. She told me, "I thought I had just become someone different. Turns out I was just underinformed. So here's what I want you to do right now. Write down which of these 5 categories applies to your medications. Then write one question for each one before your next appointment. Not a complaint, not a challenge, just one specific question. Here they are, ready to use. For blood pressure. Is this class known to affect circulation and sexual function, and is there an alternative? For cholesterol. Are my levels stable enough to consider a lower dose? For antidepressants. Is there an option with less documented sexual side effect that could work equally well for me? For antihistamines, could I switch to something more targeted for most of the year? For stomach acid medication. Have you checked my B12, magnesium, and iron recently? 5 questions. 1 honest conversation. Potentially years of answers. One last thing before you go. If you're worried about how your doctor might react, remember this. You're not challenging them. You're giving them more information to work with. The best doctors appreciate a patient who comes prepared with a clear question. And even if the answer turns out to be, This particular medication is the best option for your specific situation, knowing that clearly is still far more useful than years of wondering in silence. Leave a comment and tell me which of the 5 surprised you the most. And if you know someone who's been quietly blaming their age for symptoms that might actually have a much simpler explanation, please share this video with them. That one piece of information at the right moment can genuinely change the quality of someone's daily life. You deserve to walk out of every doctor's appointment knowing more than when you walked in. You are allowed to ask specific questions. You are allowed to say, "I read that this medication can affect these things, and I want to understand what's happening in my body." That is not being difficult. That is being your own best advocate. Subscribe for more honest conversations like this one. I'll see you in the next video.